Hello, Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about a common infection called bacterial vaginitis. Now, bacterial vaginitis has a few different bacteria that cause it. It causes an odor, vaginal discharge, discomfort with intercourse, some spotting, irregular periods, potentially some abdominal discomfort. Very common in my practice. I see between 5 and 15 patients a week for this. There's no clear answer as to what the causes are. We just see associations with an increased risk if you're stressed, change in your hormones, change in hygiene habits like perfumey soaps or shampoos that smell like fruit. Not for everyone, of course, but for some. Jacuzzis, hot tubs, working out, exercising and not showering right away, excessive cleansing or douching, antibacterial soaps. So we generally recommend just mild soaps like Dove, white bar soap works really well. Increased sex partners doesn't necessarily mean, or a new sex partner doesn't necessarily mean you have an STD. Having intercourse without adequate lubrication. There are all kinds of causes. But the bottom line is it's generally pretty easy to treat. The first line treatment is called metronidazole or Flagyl. You might also see clindamycin. Those are antibiotics that are orally or vaginally. It's a very common infection. Sometimes it can happen recurrent, and we certainly want to reduce your chance of that. It's part of the reason why, if you have an infection, we emphasize that you should get seen, you should get checked rather than treated by phone, because it's sometimes more difficult to determine the difference between a yeast infection, a vaginal infection, that's bacterial vaginitis, or some other infection like an STD. Certainly, if you get recurrent infections, you need to get help from a gynecologist to be able to sort through and reduce your chance of this, so you don't keep having the infections. There also is some associations with preterm labor, preterm delivery, or infections in pregnancy. So certainly want to avoid that around the time of pregnancy. Overall, with good treatment, you can be done with this problem and hopefully never have to encounter it again. I hope you found this information of use. Please leave your comments. Thank you.